the biggest thing, and this is why I hone in on our trainings. You've seen, we spend the first 5 hours reviewing literature, looking at the studies on how estrogens, especially, but estrogen and testosterone protect the brain from Alzheimer's disease, dementia, strokes, osteoporosis, cardiovascular disease, breast cancer, prostate cancer. I mean, when a man's testosterone is low, his prostate cancer risk goes up exponentially. His heart disease risk goes up exponentially. So I think the biggest thing is clinicians can't make this connection that hormones aren't just for reproductive health. They are literally for every single body system. Like I said earlier, if you have a hormone receptor sitting on a cardiac cell, a brain cell, a heart cell, a brain cell, a bone cell, a skin cell, that means that hormone has a job to do in that cell.
Welcome to The Functional Edge. I'm Dr. Julia Ward, and this is where science meets real-world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. Welcome to the Functional Edge podcast. I'm your host, Dr. Julia Ward, medical director and founder of Balanced Body Functional Medicine. Today, we're honored to welcome Dr. Terri DeNeui to the show. Dr. DeNeui is a nurse practitioner and founder of Avexapel and a nationally recognized leader in the field of hormone optimization and regenerative medicine. Through her innovative pellet therapy protocols, she's helped thousands of patients restore balance, energy, and long-term wellness. In this episode, Dr. DeNeui shares her expertise on bioidentical hormone replacement therapy, including the science behind hormone pellets, how to individualize treatment, and why hormone optimization is so much more than symptom relief. So whether you're navigating perimenopause, andropause, or simply want vitality with age, this is a conversation you won't want to miss. So stay tuned for expert insights that will help you take control of your hormonal health and thrive at every stage of life. So welcome.
Thank you. Thanks for having me. This is my favorite thing to do is to educate. So I could do this all day.
Great. Well, Dr. DeNeui, you've had an incredible journey from emergency medicine to founding Avexia's Health Solutions. What inspired your shift towards integrative and hormone-focused care?
Yeah. So, my background, like you said, is in emergency medicine. And I also worked simultaneously for a big hospitalist group in the Dallas-Fort Worth Metroplex at a big level 2 trauma center. And great, fun stuff, learned a lot, helped so many people. But I think where we fall short and where I really saw how conventional allopathic medicine falls short was in the hospitalist side. Emergency medicine is fun. You can stabilize disease, get them, either out, home or up into the hospital. But really from the internal medicine side, I really realized, and I started realizing this over and over early on, but I was helpless to do anything about it, that it just seemed like we were really just band-aiding a lot of chronic diseases that have prevention at the root cause and the root of treatment, which really should be prevention. And we just don't learn how to do prevention well in our training, as you know, in this country, whether you're a medical doctor or nurse practitioner or PA, doesn't matter. We're kind of focused on this allopathic model of, you have a symptom, you treat the symptom, but we're not really doing a whole lot to manage disease and prevent disease. So it kind of sparked my interest to start seeking answers. And I found myself at actually an A4M conference, World Congress on Anti-Aging Medicine, about 17 years ago. It might have been 2008, I think, January. And was just listening to a longevity talk by a doctor. And her name, I can't remember her name, but she wrote a book, you could find her probably, called Awakening Athena. And she was telling stories about just profound life change and being able to get patients off medications like antidepressants and blood pressure medications. And even in many cases over the course of time, diabetes medications and sleep medications and anxiety medications. And I just thought, wow, this is really kind of what is needed. But what surprised me is it was a hormone talk. and I just was like, wait a minute, hormones, is that just for, when we start having hot flashes or men start becoming grumpy old men, kind of thing in our 50s. But I kept digging. And yes, this hormone conference was focused on postmenopausal women. But what I found as I kept learning, and I started learning about testosterone specifically, that these deficiencies start way younger than our 50s for women and even men in many cases. And now I think even younger and younger, obviously, as you know, because of just our food, our dietary practices and things in this country. So it started me on this journey, and I transitioned my little 10 by 10, aesthetic practice. I was just in a room, and I moved and joined another practitioner and started doing hormone optimization. And then about a year later, I learned how to do hormone pellet therapy. And that was just a game changer, and it just has exploded. And then, now, as the rest, as they say, is history. I've really been able to take a lot of that knowledge and, lectures I've done and teachings that I've done, and wrote a book, and just really educate, because there's still so much misinformation. So long answer to your question, but
Okay.
sorry.
That's great. That's great. So you developed the Avexapel method. What sets this approach apart from other pellet insertion techniques?
Yeah, so I trained about in 2009, so 16 years ago, with, who we called the godfather of hormone pellet therapy. That was Dr. Gino Tutera. He's since passed away, but he really was a pioneer in this space. And what I found is the protocols that I learned from him worked beautifully, but not for everyone. And what really bothered me was the outlier patients that, it seemed to either not work. I'm going to air quote that, because you can get fuel in the tank, but why isn't it getting in the cells? Why isn't it relieving symptoms? What's going on with these people that it's not working? So I spent the better part of the last decade really just trial and error, going to more functional integrative medicine conferences, really understanding the role of hormone receptor activity in the gut. And there's so many nuances that go into hormone optimization. It's, again, I learned, even though it was pellet therapy and it was a pioneering, modality, I still learned in an allopathic way, because what they were teaching me was, oh, your patients will have all these symptoms, and here's hormone pellets that can address those symptoms. But there's a lot of other things that, just kind of weren't right. So just trial and error and learning and adding things, I think we're still learning and changing and adding. We've, done things to perfect the insertion technique. I'm limited to every quarter I can update my lecture slides, but we really always like to know what's latest and greatest, what's new in the hormone world, because it's fluid. I mean, it's changing. There's more and more information coming out. I have lectures and I'm teaching things that I didn't learn 16 years ago or 10 years ago, and so forth. So it's constantly evolving. Yeah. I think that's the biggest thing that sets us apart, is we're really committed to maintaining that evolution and making it better in
Yeah.
what we can.
That's awesome. Well, for listeners who may be unfamiliar, can you explain what hormone pellet therapy is and how it works in the body?
Yeah. So hormone pellets have been around since the 1930s, and it's bioidentical hormones. So bioidentical just means your body recognizes it as bioequivalent to your hormone that your body makes. So interestingly, the 5-ring carbon structure of the yam plant is identical to human hormone. And so when compounded and when they make a powder, they create a powder, and that is what we used to use soy and or yam, but now it's just yam. We don't use soy anymore. But bioidentical hormones are created at the base from this type of source. And so when, I like to just backing it up to bioidentical hormones, I like to give the analogy of a key and a lock. And the hormone, the right hormone, the bioidentical hormone, if you've ever had a key that fits in a lock and doesn't really turn the lock all the way, you can liken that to a synthetic hormone. But a bioidentical hormone hits that receptor and unlocks that lock and allows all of the processes that hormone is supposed to, the action that hormone is supposed to have in that cell to happen. And that's a really important distinction, because even the word hormone means impel, to urge, to move on, to cause an activity. So if there's a hormone receptor on a cell, you know that there is a hormone that is supposed to provide an action in that cell. So hormone pellets were discovered and really utilized in this country to a great deal, and were being studied in the mid 30s in women who had had hysterectomies with their ovaries removed, and it worked great. They loved it. They got estrogen levels up to pre-menopausal levels. And then in the 40s is when we discovered our ovaries actually make testosterone, and it's a vital hormone. It's an incredible hormone, as you know, for vitality, moods, brain function. My doctoral work was on depression and androgens, testosterone deficiency in women. And so that was really a game changer for women at that time. And then Premarin came on market in the mid 40s. And by and large, this magical pill that really changed lives for many, many women became the mainstay of hormone therapy in our country. And so hormone pellets as an option, as a modality, really kind of fell by the wayside, and then kind of made a resurgence back in the 80s and 90s, and especially in the last couple of decades here in the States. So they've been around a long time. The difference and why I love them over the other modalities, besides the fact they're bioidentical, is you can really dial in on the dosing. And the biggest thing is you have that hormone available because these little tiny pellets are placed in the skin, and it slowly is releasing that hormone into the system. You have your levels up 24/7 for a good 3 to 5 months, rather than I put a patch on, it lasts for 3 days, or I take a pill and it lasts for just that day, and you're on this roller coaster. Or in the case of men, I get a shot of testosterone and I really spike up high for a few days and then I crash. Yeah. So it takes away this roller coaster effect of the other modalities that are available.
Yeah. Yeah. And just, so many of my new patients come in and they have such fear or misinformation about hormones in general. Like, isn't this going to cause cancer? Isn't this, so I have to kind of put it in context that a lot of those, those relationships to cancer were really done using the synthetic hormones like the Hormone and the Provera.
Yeah. And even, the more recent data even shows that the synthetic estrogen protects women against breast cancer and death from breast cancer, which isn't what we would want to use. But the data that was reported around breast cancer obviously was skewed and really created a lot of fear. Unfortunately, it was actually the synthetic progestin in WHI that caused all of the negative effects of that hormone. And so, it's created a lot of unfounded fear.
Yeah. Yeah, absolutely. Well, who would you say would be an ideal candidate for pellet therapy, and who might not be a good fit?
Well, really for females across the age span would be a candidate for pellet therapy if they're symptomatic. And even as young as in women in their 20s, if they're on birth control pills, it's blocking their testosterone production. And so really for women, it can be any female that's suffering from depression, moods, anxiety, irritability, low sex drive, brain fog, difficulty sleeping at night, fatigue, those kinds of things. Those are pretty global testosterone deficiency symptoms. And then, of course, as women transition through the hormone changes through life, and we start having estrogen fluctuations typically in our late 40s, early 50s, and then that would be an opportunity to add in estrogen or estradiol mix. And so that's for females. And really males, same thing. Honestly, we're seeing younger and younger males now. I typically don't like to give testosterone replacement to young males that are still reproducing because it can suppress your sperm production quite significantly. And so, we really can, a lot of times in these young guys, we can work on their diet, get them some certain nutrients, supplements, things like that can kind of help turn that around. But that takes lifestyle changes, and that's hard for a lot of people to do. But really the only, absolute contraindication for estrogen therapy in a female would be active breast cancer. And that's just because it's not standard of care. And really the only contraindication for testosterone pellet therapy would be in a male with an active prostate cancer that's being treated. Otherwise, there really is no contraindication, because all of the side effects, the negatives that you read about with hormones, are typically in oral form, which have a much higher side effect profile.
Right. And so how does pellet therapy compare to other forms of bioidentical hormone replacement, like creams, patches, injections?
Yeah, so they're all just depends on the patient. We have used all of them in our practice. We have a handful of patients that use creams. We have a handful of patients that use patches and males that use shots. And it just depends on the patient. Maybe, that's just their preferred modality for whatever reason. But they're all good. I think the only hormone that I would never prescribe to a patient would be a synthetic progestin.
Yes.
Progesterone, a progestin oral. I wouldn't probably first line if a patient didn't want hormone pellets. I wouldn't probably use oral 17 beta estradiol, which is available commercially and is very well studied and very safe and efficacious. There's a slight increased risk in certain populations that it can increase clotting risk, but there's patches available commercially that are bioidentical. There's oral bioidentical progesterone available. Creams do okay. I use a lot of creams in women that maybe are breast cancer survivors, and it's really great for vaginal discomfort and things that happen locally in the vaginal bladder area that because of low estrogen, and maybe they can't get estrogen replacement because they're in the middle of a breast cancer treatment. So creams work beautifully for that. We use a lot of creams of testosterone for women for libido when applied vaginally. That works really great for libido. So there's all different kinds of modalities. I think, about, I would say 95% of our patients, we see about 1,000 hormone pellet patients a month get hormone pellets because they're convenient. They don't have to worry about it for, 3 to 5, sometimes 6 months, depending on the patient. And so there's all kinds of different modalities, but it just depends on the goals for the patient, the goals of therapy. What we're dealing with. So,
I always like to give my patients my perspective of when I went into changes hormonally, and I didn't, some women don't ever have hot flashes, and that doesn't necessarily mean that you're not going through menopause. But so I never really had hot flashes, but what I did have was overwhelming fatigue. And the fatigue was not alleviated by hormonal cream. Like the cream, I couldn't tell if I was on or off it. It didn't make a bit of difference. But the minute I got a pellet, or I'd say about a week after I got a pellet, it was night and day different. It was all of a sudden, oh, now I feel like myself again, and it was just pushing that testosterone to what we consider super physiologic levels. But that's where I felt really good. And that's where I started having easier time building muscle and decreased inflammation, better sleep, all this kind of stuff. So, what do you say to concerns about getting these testosterone levels to these super physiologic levels?
Great question. I wrote a white paper addressing this very thing. And I'll tell you who has the best paper is Dr. Rebecca Glaser, Glaser. You can Google her. All of her papers are, for your audience, are available on her website. And she has a paper that is called Super Physiologic Levels for a Physiologic Effect. And she explains why women, as we age, need higher serum or blood levels of testosterone to cause an effect to alleviate our symptoms. And she explains it really beautifully. There's a lot of things that happen as we age. Our hormone receptor activity becomes desensitized. There's hormone metabolism, gut health plays a big role in this whole conversation as well. And so, some women and some people, women, men and women, have really high what we call sex hormone binding globulin, which is a protein that binds up your testosterone that's available. And so all of those factors combined, and this is where I have to really educate patients and other clinicians, that blood level on your lab slip really doesn't mean anything, because what causes the symptom relief and what exerts the action at the cellular level is not measurable. The only way to measure that is by the patient going, my symptoms are gone, I feel great. And so 300 is my number, or whatever it is.
Yeah.
And so this is a big, area of education. And I did a lot of research on this and wrote a paper because there's a lot of patients and doctors that are so confused about it. And when you really look at the literature, it speaks to over and over our lab, the way we test for testosterone levels, especially in females, there's not a good methodology that's accurate and reproducible. And so we've got to kind of quit, let's put it this way. In the OB-GYN world, in the gynecology world, when a woman comes in and complains of hot flashes and symptoms of menopause, there is no gynecologist that I've ever met that says, let's check your blood levels first and let's put you on this medication to address your symptoms. Their blood levels not even checked. If you haven't had periods in a year, you're having these symptoms. Oh, you're at menopause. Here's your estrogen. They don't follow and track that. So why are we doing that with testosterone? We see that you have a relative androgen deficiency. You can see that with a free testosterone level. And then we treat you. And when your symptoms are relieved, we shouldn't even be looking at it again after that, really. But, we're kind of hung up on this lab thing, and it's a sticky wicket.
Yeah. Yeah, absolutely. What kinds of transformations do you commonly see in patients after beginning pellet therapy? And are there certain symptoms or conditions that respond especially well?
Yeah. So I will say again, it's why I chose it for my doctoral research is depression in women, especially after that second baby. Women will complain of just not only fatigue and all of the other things, but really the blues, the blahs for no reason. It really impacts relationships. It impacts marriages. And what I was noticing early on after I started doing pellet therapy in my clinic was that women were able to come off their antidepressants because all of a sudden those symptoms were being relieved and the antidepressants were causing side effects that we were trying to get rid of, like low libido, weight gain. These are the top 2 side effects of antidepressants. So I was able to transition the majority of my patients off of their antidepressants, and then I began to research it because I saw it experientially in my clinic. And I was like, okay, there's got to be some science behind this. And of course there was. And I wrote a paper about it. But that is a big one profoundly, is moods, especially in women that are in their 40s, because in our 40s, not only is our testosterone low, but progesterone starts to get low. And that's when we really see, I think our 40s is the female midlife crisis age, if there is such a thing. Yeah. And it kind of hits in our 50s. And and it really impacts relationships and marriages. And so that I'm really passionate about that. So that's a big one. But sleep, of course, and libido. Of course, women lose libido. Men don't really ever lose desire so much as they lose ability, but women actually lose desire significantly, and that impacts relationships. So libido, energy, brain function, moods, those are kind of the top 4 for females, I would say. And for men, kind of energy and brain function also. And the biggest thing men complain of in this, andropause time frame is that kind of the desire to do the things they once loved is just meh. Like maybe it's golfing, maybe it's fishing, maybe it's whatever it is. And then of course, as they lose testosterone, they get sarcopenic, their muscles kind of waste and their belly gets bigger. And, you have the typical midlife looking guy, and that can actually be fully reversed, as you know, with testosterone.
Yeah, absolutely.
And I want to say one thing about is key that you're saying this. I have had patients on every modality of testosterone that there is available. And I will say, hands down, hormone pellet therapy gives the best symptom relief because I believe of the 24/7 availability in the system. And there's not a spike and a drop.
Yes.
That roller coaster that people experience with other modalities really isn't, you feel good for a few hours or a few days.
Yeah. It's just not as ideal. You don't get that even distribution. Yeah.
Traveling, got to carry it with you and all these things.
Yeah. What are some potential side effects patients should be aware of with pellet therapy?
The side effects are for testosterone are typically women experience this, are nuisance side effects. There are no side effects of hormone pellet everywhere. Testosterone that are irreversible. They're just, we are not getting levels. It's not, a lot of mistakes that people make is they take the side effect profile of anabolic steroids with masculinization and apply it to bioidentical testosterone. It's not the same.
Right.
So you don't have the hair loss. Testosterone is actually a metabolic hormone. It causes hair growth. In fact, that's probably the number one nuisance side effect is it causes hair growth in places a lot of women don't want it, especially if you have dark hair like me, blonde like you don't really see that problem as much. But us dark-haired ladies, we definitely, dark-haired ethnicities, we see that more. So it's a nuisance side effect, but it's not really a game changer because you feel so good. You're like, I'll just get lasered or whatever. Yeah. So that's the main one for testosterone. And, for estrogen, it's really, I just don't see a lot of side effects unless women aren't getting enough progesterone or they're not absorbing their progesterone. They could have some breakthrough bleeding that's manageable, obviously, with the right intervention. So the side effect profiles are dose adjustable nuisance side effects that can be fully mitigated with just adjusting doses. And I'll say too, one of the things that we teach, which is just the art of hormone pellet therapy. And, and there is an art to it. There's a science for sure, and it's very backed by science, but there's an art to it. And starting low and going slow and adding more, as the patient needs it is a really good approach. And I think the problem is there's so many people that just go do an online pellet training, or maybe they, do a 1-day certification where they're just kind of learning how to put it in. It's more than just a procedure, as you know. There's a lot of nuances that go into the dosing. And so I think when you talk about side effects, in our clinic, we don't see a lot because we're experienced and we know how to do it. But there's a lot of clinicians out there that don't really understand the nuances, and we see more side effects in that population.
Yeah, definitely. Yeah, we get the same concerns, and especially if I get somebody who's been pelleted somewhere else and maybe had a bad experience because they were overdosed with stuff and it caused some side effects.
Yeah. And again, not permanent, but it's can be scary, and it's definitely annoying. But yeah, that's the biggest thing we see is patients coming to us from maybe another clinician that, didn't have good training, or maybe they did get good training and they only do 2 or 3 or 5 pellet procedures a month. So they don't have the experience to really understand the nuances of it. So
I always tell my patients that it's easier to pellet women, but it's harder to dose them.
It's harder to manage them.
And it's harder to dose. It's harder to pellet men, but it's easier to dose them because
that's right.
If I do too much on a man, it's not as big of a deal. They're just not going to have any, much side effects.
And even too much on a female, maybe I think too with, the pellets that we use, which have made a big difference, because I've used pellets in the past that had a really rapid rise and a rapid fall. You saw a lot more side effects. So one of the things that we really worked hard on and worked with a pharmacy to improve is this side effect profile. And one of the biggest ways we did that is to create a pellet with an ingredient in it that kind of almost acts like a time release. It slows down the peak and the fall. You can slow down that peak. You mitigate a lot of side effects, because a lot of the side effects for men, especially if they're on shots, come from that rapid peak. So they get higher estrogen levels and they get higher, red blood cells, and their hemoglobin hematocrit, their blood gets thicker, but you don't see that with a slower rise and a slower fall. And I think that's the other thing. We see a lot more side effect profiles in patients that maybe have come from another pellet provider that uses a pellet from a pharmacy that has that rapid rise and that rapid and that hormone dumping into the system.
Yeah.
So it's not all hormone pellet practitioners are created equal, but not all hormone pellets are created equal. And that's the key thing for your listeners to understand.
Yeah. Yeah. And I have to say, I absolutely love the pellets from Avexapel because I think they're great quality. I love the triamcinolone coating on those. And that's been a real game changer, because before I was using your pellets, a lot of my male pellets would reject. There was always a handful of men where the pellets would just kind of work their way out. But with the triamcinolone coated ones, which is a steroid, it just decreases that inflammation, and I haven't had any reject.
Yeah.
So it's
it's been a game changer. So they actually granulate and mix in the triamcinolone with the whole pellet. So it's not only on the outside, but as it dissolves, it maintains that low and anti-inflammatory state in the bed where that pellet is. And so it has been a game changer. I remember way back in the day, I would have guys that for no reason just, my pellets are popping out again, and it's so frustrating, and it keeps them from, staying on the therapy. But this has been a game changer. That triamcinolone infused into the pellet has been amazing.
Yeah, and I think I haven't found any other pharmacies that do the same thing. I think you guys
our pharmacy has a patent on that pellet, so no one else can do it.
Okay, awesome.
Yet, so the patent wears out.
Yeah.
And plus, there are pharmacies that have tried to figure out how to do their own formulation. But let me tell you, it took us 2 years to get this thing right. It takes a long time to figure out the nuances of granulating a pellet and getting it just right. And then you have to meet certain specs. So, this probably might be on your questions coming up, but everybody says, oh, are the pellets FDA approved? Well, the pellet making process, because testosterone is a controlled substance, is highly FDA regulated. And for males, pellet therapy is FDA approved. Testapel is a pellet that's FDA approved. But for females, it's considered off-label. But there are such tight controls that the FDA requires on your granulation of triamcinolone. That is really hard to do. You can ask our pharmacy lab techs and the people that have worked on this for so many years, but they have to maintain like very narrow percentages, and it's tough to do. So I think that's one of the biggest reasons why a lot of pharmacies haven't really been able to figure it out.
Yeah.
You got to have some brilliant chemists in there.
Yeah. That makes sense. So do you approach pellet therapy in perimenopausal women versus menopausal women slightly differently?
Yeah, perimenopause. It's a mentor of mine used to call it no man's land, because it can be all over the place from minute to minute, day to day. And it is a rough time for women, because that's the time for women, as you know, for your listeners, when estrogen, it fluctuates. And the fluctuation is what causes the misery, right? So things can be happening like moods and heart palpitations and hot flashes, and, it's just all over the place. And so, but the problem is, until you go 12 months without a menstrual cycle, you really can't get a full dose of estrogen. But with pellets, what we have is a perimenopausal dose of estrogen that is a very low dose of estrogen that you can put in with your testosterone pellet that keeps kind of a basal, like a baseline of estrogen. So when a woman's fluctuating and her levels dip below, which would have caused those symptoms, she's got that kind of tank that's about a quarter full always, so she doesn't run out of estrogen gas, right?
Yeah.
So that is just a game changer. I'll tell you, I'm 57. I went through this 9 years ago, and I kind of at first, it didn't clue into me what was happening. I just thought, I'm going crazy. I can't remember anything. What is happening? I was having heart palpitations, and, I wasn't even thinking that it could have been estrogen fluctuations. But I started thinking, I was like, wait a minute, my menstrual cycles have been really irregular. And that's the first clue for women. Your menstrual cycles will go from every month regular. Do you skip a month? Do you skip 2 months? Do you skip 3 months? And then you're having them every month again. And it can last from up to 8 years, like 2 to 8 years. It can be a pretty big chunk of time. Most women, it lasts 2 to 3 years on average.
Yeah.
But when I finally figured it out and got that perimenopausal dose of estrogen, wow, it was like the lights came on. I thought, now I understand what my patients are talking about when they say, I felt like I was walking around in a fog, and all of a sudden it's like, oh, I can see.
Yeah.
Husband likes me again. And
Yeah. Are there complementary therapies or lifestyle interventions that you recommend alongside pellet therapy to maximize results?
For sure. I think the number one thing is the gut, and this whole conversation of gut dysbiosis, meaning bad bacteria overgrowth in the gut. And, in fact, I'm working with an endocrinologist right now that has written the gut happy hormones, book, and she's going to be releasing in the fall. But there is so much interplay between the gut microbiome and the brain and the endocrine system. We're calling now the gut its own endocrine organ. So if you're not paying attention to Hippocrates said it centuries ago, what all disease begins in the gut. And it really is true. And I think we're just now starting to get mainstream about this gut health thing. But the number one thing I think people can do, because, we are toxic overloaded, we can't help it. If you're a breathing, living, walking human, you're going to be just toxic. And so the best thing we can do is give our bodies the support that it needs. Our food is very nutrient deficient in this country, even just the soil that it's grown in. So unfortunately, we do have to supplement with key things that optimize hormones, like good health probiotics, because when the bad bacteria in your gut overgrows, it impacts your hormone metabolism and can increase the retention of more cancer-causing hormone metabolites. We don't want that. We want those to excrete through the bowel. Also, diindolylmethane, which is what's found in cruciferous vegetables, helps push our estrogen metabolism down a healthy metabolism pathway. Vitamin D plays a huge role in hormone receptor activity. Iodine plays a huge role in thyroid production, and selenium for Hashimoto's. And so, those are kind of the big ones. And then we developed a hormone metabolism kind of supplement that really helps with your free testosterone levels and things like that. But you have to pay attention and get some key nutrients to supplement to help your hormone optimization. And then you got to take care of that gut. And if I had it all my way, I would just, I tell patients, if you could just not eat anything that opens in a package, as much as possible. I mean, just cutting that one thing out, you'll be amazed at the inflammation that comes down in your body. But it plays a role. I mean, the inflammation plays a huge role in this whole conversation.
I think that's one of the biggest things that I've learned over my years of doing pellet therapy is that the very few percentage of women that come back and say, I didn't feel any different after a pellet.
Yeah.
And I know that those are the ones that we didn't address some source of inflammation, usually coming from the gut. Yeah. And then we have to go back to say, well, what are we missing? Because there's some inflammation that's not allowing you to feel the benefits of these hormones because
when you have an inflamed gut, lipopolysaccharides, and it causes brain inflammation, and you're depressed and you're moody and you can't think. So all the symptoms that I'm trying to fix with the hormones, you can't really tell because you've got another root cause. So you had two root causes. I fixed one with the hormones, but we got to fix the gut.
Right. It's just like if you're sick with a virus or, a bacterial infection or something, you're not going to feel the benefits of the pellets either because you're going to be, your body's fighting off, that inflammation. And so,
absolutely. Yeah.
So you've trained thousands of practitioners. What are the most common mistakes or misconceptions you see amongst clinicians just starting out with pellet therapy?
I think the biggest mistake that I see new clinicians that come and spend 2 days at our training, and we have just developed so much to help clinicians stay. We have a forum for these clinicians to ask questions and stay engaged. I think the biggest mistake is the ones that come to training and don't go back and start doing it because you have to actually start doing this therapy so you can become proficient and good at it. And so that's the biggest mistake. But besides that, I think the other one is implementing bits and pieces of the method. In other words, maybe they'll just do pellets, but they don't really want to mess with supplements and they don't care about the gut. Well, okay, you're going to help about 40% of your patients feel better for a little while. But the other 60% need this extra help. So that is a big mistake I see, clinicians make. That's really probably the biggest one. And just, again, not doing it because it takes practice. You got to get in and do something to get good at it, right?
Yeah.
You learn how to ski. You don't go ski once and then expect to be great at it if you do it once a year. You got to practice, and that's how you learn. Everything I teach, everything I train on is what my patients taught me throughout the years. And that's how you learn stuff.
So in your book, Hormone Havoc, you aim to educate both patients and providers. What do you think is still misunderstood about hormone health in mainstream medicine?
It's the allopathic model. I think the number one thing is, when I say allopathic, just for your listeners, it's the training that we all got to give a medication to address a symptom. The biggest thing, and this is why I hone in on our trainings, you've seen, we spend the first 5 hours reviewing literature, looking at the studies on how estrogens, especially, but estrogen and testosterone, protect the brain from Alzheimer's disease, dementia, strokes, osteoporosis, cardiovascular disease, breast cancer, prostate cancer. I mean, when a man's testosterone is low, his prostate cancer risk goes up exponentially. His heart disease risk goes up exponentially. So I think the biggest thing is clinicians can't make this connection that hormones aren't just for reproductive health. They are literally for every single body system. Like I said earlier, if you have a hormone receptor sitting on a cardiac cell, a brain cell, a heart cell, a brain cell, a bone cell, a skin cell, that means that hormone has a job to do in that cell. So we have to kind of get away from this, it's just for hot flashes and libido and erectile function in men, and realize that we're really preventing chronic disease. And the earlier you can start really looking at this, the better. I mean, I'm seeing young guys, 20s and 30s with very low testosterone. It has everything to do with our diet.
The toxins in our environment,
Yep.
And head trauma.
Oh,
Yeah, I didn't realize this until I did a course looking at this, but head trauma really affects your hormone production. And so, a lot of our veterans who come back with blast injuries and such, they are
love
actually
it that you
suffering
said
from
that.
really low testosterone. And maybe they're having behavioral changes, anger outbursts because their testosterone is just in the toilet.
Can I tell you a story about that?
Yes, please.
Yeah, so I had a patient who came to me, and her husband was a vet. He was a paratrooper. He jumped out of helicopters.
Mhm.
And she goes, you think my husband, like, he has a lot of these symptoms. I said, well, yeah, we should get his testosterone checked. And she goes, well, he goes to the VA every month. He's on disability for his depression and this, that, and the other. I think they would have tested that. And I said, probably not. Unfortunately, our veterans get the worst care, and I'm working hard to change that, actually. But so anyway, she brought him in, and this guy's testosterone was 19.
Oh my gosh.
He had hit his head. I said, have you ever had a traumatic brain injury? He goes, how many have I had? It should be.
Yeah. Yeah.
So, I mean, it was amazing. This guy had such debilitating depression. He was honorably discharged from the military. And we were able to reverse that depression with hormone optimization and hormone pellet therapy within 6 months. Actually, he really started feeling the benefits earlier than that. And that's just a huge example. And I love that you said head injuries, because here in the South, where we got all these young kids getting banged up with football, in especially high school football here in Texas, you see this a lot. But even college ball and the pro ball players,
Yeah.
the other thing I'm really trying to do is educate the NFL Alumni Association about testosterone. These guys, when they retire, unfortunately, they can't get it while they're playing. But I've had pro ball players that could not wait, that have treated their wives, pro football players, the day they retired, they came in to get their testosterone because they had it tested. They knew it was low, but they can't get replacement because it's considered a performance enhancing drug. And it's a catch-22 because every time they hit their head, and let me tell you what else, within 20 minutes of a TBI, even a mild concussion, you have intestinal permeability, leaky gut, junctions open up.
Yeah.
So it causes issues with the gut too. So I love that you brought that up, and I appreciate that because we don't talk about that enough.
Yeah. Yeah, absolutely. That is definitely not well known enough.
I don't even know that I wrote about it in the book. I should probably write a chapter about it because it is. It's a big deal. It's a really big deal.
What advice would you give to patients who feel dismissed or confused about their hormone symptoms and don't know where to start?
Well, come see you or a provider that's been trained and understands. I mean, I have to say, you got to give your clinicians a break. If you don't feel heard or understood, it's probably not that you have an uncaring doctor. It's probably you have an uneducated doctor. And that's not their fault either, because we're not taught these things in our primary programs. You have to seek help. So if you have a doctor that you love, that you think could really help people, then you can send them to our website and go get trained in this stuff.
Yeah.
But I think finding a provider that has been trained and really does this in their practice like you, I think that's a big point for your listeners if they're, somewhere not local and you're too far to see them or whatever, when they're looking for somebody that does this, ask them, how many hormone pellet patients do you see a month? How many pellet procedures do you do a month? Because if they're doing, less than 25, probably want somebody that's a little more experienced.
Yeah, absolutely. Well, looking ahead, where do you see the future of hormone optimization and integrative medicine going? Like, what excites you most?
Well, I'll tell you, and I'm going to say, please hear me. This is not a political statement, but I'm very excited about where we are with the mindset around disease prevention in our current government climate. And we have an opportunity right now to really radically change some policies with food and things like that. And that's one thing. I'm actually a part of a Healthy America First Women's Initiative for health for women and children. And I'll be in DC in 2 weeks, actually, to really help start developing policy around this. The current people that are there really are interested in this and realize that the chronic disease, we are the wealthiest, and we have some of the most technologically advanced healthcare in this country, and we are one of the sickest nations in the world. That shouldn't happen. That should not be happening. And so we're finally recognizing that, hey, food plays a role, and hey, maybe we need to start looking at disease prevention and root cause. And so I'm really excited about the opportunity to educate lawmakers. And that's really what I'm excited about, because, we have lawmakers in DC that are on both sides. It shouldn't be a political,
Correct.
the fine line thing. This is American. We're all human, right? So I'm really excited about that. The scary part that I'm learning is that it takes a long time to make those changes, but you got to start somewhere, and having an opportunity to kind of sit at the table with and educate some of these lawmakers, I'm very, very excited about.
That is great. That is really exciting.
Because, this needs to be standard of care, especially for women. Testosterone therapy, it especially pellet, it should be standard of care for women, because because there is no FDA approved drug, that the synthetic drug that the pharmaceutical industry has created to address testosterone deficiency in women, it's an unknown phenomenon, right? Because the drug companies are who educates our medical schools. And that's another thing that our administration currently is really looking at, is getting the bias out of medical school. These are things that, again, doesn't matter your political affiliation. This is just the right thing to do.
Yeah. And I get that question a lot of, if this is so great, why isn't it part of standard medical care? And I have to go back and say, well, ages ago, the Supreme Court made a decision that you cannot patent something that occurs naturally in nature, like hormones. It's like you can't patent water. And so the drug companies have no incentive to, have everyone on bioidentical hormones, because they're not making a big profit off of this.
The interesting thing about that to me is estradiol patches are bioidentical. My guy's progesterone is bioidentical. So it's just, there's no money in it. That's the bottom line. It's cheap. Yeah. It's cheap medicine. And I'll tell you, I'm cynical, but I'm being cynical, but it's truthful. We don't want cures for disease in this country. They're very profitable. Obesity is very profitable. Cardiovascular disease, diabetes is cancer, very profitable. So why would we push a therapy or therapies that help decrease disease burden? Alzheimer's disease, oh my gosh. I hate to be a cynic, but you follow the money. It's easy to see. I'll give you an example. So this is a really interesting phenomenon, that the number one cause of non-Hodgkin's lymphoma is glyphosate, which was created by Monsanto, Roundup. We are the only country that has not outlawed glyphosate on our food. First of all, let's start there. Okay. Second of all, Monsanto was bought by Bayer Corporation. Bayer Corporation also has a chemotherapeutic drug that treats non-Hodgkin's lymphoma. So they own the cause and they own the treatment. That should not be happening. People need to know.
Sounds like a huge conflict of interest.
Huge conflict. And that's just what we know about. And there's so many stories like this that when you get to rubbing elbows with people that are in the know, you kind of go, this is sickening. What is happening in our country? So, So long answer to your question, but I'm really passionate about it because it is. You think about our kids and just so many of the diseases, type 2 diabetes used to be called adult onset. Now it's not, because 1 in 7 kids has type 2 diabetes, which is a totally diet driven thing. And
diet and toxin driven.
And baby formulas. We're seeing more and more with baby formulas, and how we start babies out just getting them addicted to the chemicals and the sugars that are in baby formula. And it's a real issue, and people need to wake up to it, because it's really real.
Yeah. Well, thank you so much for joining me today. I'm going to put your information about Avexapel on the show notes. I know I will refer that patients to it, patients who are living outside of Texas, and I only see Texas patients, but they can find somebody who is a provider in their area on your website. So
I appreciate you having me on, and, obviously I'm passionate about it, and thank you for giving me an opportunity to share.
Absolutely. Well, thank you for joining us today on the Functional Edge podcast. I hope you've enjoyed this insightful conversation with Dr. Terri DeNeui and come away with a deeper understanding of how hormone optimization can be a powerful tool for restoring health and vitality. Really, hormone optimization is the cornerstone of any anti-aging program. wherever it is. You have to have your hormones optimized. To learn more about Dr. Terri DeNeui's work and Avexapel approach to hormone therapy, be sure to visit Avexapel.com. And if you're curious about whether hormone optimization might be right for you, I encourage you to start a conversation with your provider who understands the full picture of your health. So until next time, I'm Dr. Julia Ward. Stay informed, balanced, and keep leaning into the to the edge of what's possible with your health.
Thank you for joining me on The Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the functional edge.